So welcome. My name is Kevin Impellizeri, and I'm here with the College of Physicians of Philadelphia. We're glad to be here at this event, which is focusing on learning about vaccines, how they're made, how they're important, and how they help keep us healthy. This is part of a big event that we do, which we're going to learn about today, called Teen Health Week. You're going to start with me. I'm going to test your knowledge about vaccines. We're going to learn a bit about Teen Health Week, and then I'm going to turn it over to our esteemed speaker, Dr. Kristen Feemster. Newborn babies are at risk of contracting pertussis, also known as whooping cough. What vaccine do doctors recommend parents and family members receive to reduce newborns' risk of contracting it? Is it A, an HIB vaccine? Is it B, a Tdap vaccine? Is it C, an MMR vaccine? Or is it D, a Hep A vaccine? All right, what do you think it is? Tdap. Tdap is correct. It was the Tdap vaccine. Tdap is short for tetanus, diphtheria, and pertussis. So if you knew what it stood for, that gave you the answer. Parents and all family members who plan to be around a newborn baby should get a Tdap vaccine. In fact, doctors recommend all pregnant women also receive a Tdap 27 to 36 weeks into their pregnancy. All right, next question. Which vaccine did scientists create in the 1970s by using a virus isolated from a young boy in Japan? Was it the rotavirus, chickenpox, the mumps, or measles? B, chickenpox is correct. Chickenpox vaccine. Scientists developed the chickenpox vaccine by isolating chickenpox virus from a young boy in Japan. Today the strain is known as the Oka strain, after the boy for whom it was extracted. Okay, our next question. While most vaccines are not given to pregnant women, which of the following vaccines are recommended for pregnant women? There are two in this one. So is it hepatitis A and the HPV vaccine, the rotavirus and hepatitis B vaccines, influenza and pertussis vaccines, or the HPV and MMR vaccines? A lot of answers to that. All right, team 5.
All right, it's the one that had pertussis. I don't know.
All right, that's close enough. Influenza and pertussis is correct. Okay, here's your backtrack for this one. The influenza vaccine is recommended for pregnant women because they have an increased risk of suffering complications if infected with influenza. It's also recommended pregnant women receive the Tdap vaccine, which we heard a couple of questions ago, in the 27th and 36th weeks of their pregnancy to protect themselves and newborns from pertussis.
Good afternoon, everybody, and thank you very much for being here and for having me here. As Kevin said, I am an infectious diseases doctor for kids from Children's Hospital. I also work with our Vaccine Education Center, and I also work with the health department with their immunization program. And I work with a group that does like surveillance, investigate outbreaks and things like that. So I'm really here today just to talk to you about vaccines, vaccine preventable diseases, and to answer your questions. So no, that is not true. That is not true. And I know that's something that people say sometimes. They're like, what, this vaccine, this is just part of a, conspiracy to make sure that you can get people sick so that, hospitals, yes, they can make money, pharmaceutical companies can make money, but vaccines are really, they are designed and developed to keep you from getting sick. That is what they are there for. They are designed to help prevent you from getting the different infectious diseases against which they protect. And in fact, if you look, so before we had vaccines, there were thousands and thousands of kids, mostly, and some adults who got very sick and died from things like measles, whooping cough, pneumonia, things like smallpox, polio, which led to disability in thousands and thousands of people. And so since we've had vaccines, actually far fewer people develop these infections. So if anything, it's really helped support a healthier communities and healthier society. Yes, and so I think that these are two things that are frequently confused. And so, we all talk about getting colds. I mean, who's had a cold already this season? I've definitely had a cold. I have 2 young kids. They've had colds. You know, we all get colds. And really what that is a respiratory infection that can be caused by lots of different viruses. Right? There are lots of different viruses that can infect our respiratory tract and can give us a stuffy nose, a cough, a little fever. And so rhinovirus is probably the most common cause of a common cold, or, you know, a cold. Parainfluenza virus is another one, adenovirus. There are lots of different viruses. Flu is also a respiratory virus, flu or influenza, but it is something that causes, I would say, even more than a cold, usually in people. So when you say I have the flu or influenza, that is a specific infection from the influenza virus, and usually that makes people a little bit sicker than, like, you know, if you have a cold and just a runny nose and a little cough. We usually get fever, maybe a sore throat, a cough. They can get pneumonia, get very achy. Usually when people say I have had influenza, they feel very sick and know that that feels very different than a cold. So the human papillomavirus vaccine actually has an excellent safety record. And so it is a very safe vaccine, and we actually know quite a bit about it. You know, the HPV vaccine was first licensed and introduced more than 10 years ago now. So it was first licensed in 2006. So we've had a long time to, you know, see, you know, how it works. And, you know, from the time a vaccine is introduced, we follow how well it works, and we also follow its safety. And then even before a vaccine is licensed, its safety is evaluated very, very rigorously. And it has to, because before a vaccine is licensed, it has to pass a really high bar of safety and also a high bar for you know, effectiveness. So when vaccine manufacturers are making a vaccine, they do lots of tests and studies to make sure that the vaccine works well and can be given safely. So even before a vaccine is licensed, we know a lot about its safety. But in all the studies have really looked at vaccine safety. The thing that we know can happen is you can get arm soreness, you can get a fever, that can happen, and for some people you can have fainting afterwards if you don't kind of sit down for a few minutes. So if you've gotten HPV vaccine already, I hope many of you have, you were probably asked to sit down. So that is one question, or I would say misconception, that many people have about the flu shot. And so no, you can't. So the way that they make the flu vaccine is you do take a flu virus and you grow it so you can make a lot of it, and then you completely inactivate it so that there's no way that it can you know, reactivate or replicate when it's given to you in the vaccine. So the flu vaccine does not cause or give you influenza infection. You know, like any vaccine, it is designed to stimulate your immune system so that you make antibodies that are specific to the influenza virus, and also so that you activate the part of your immune system that gives you some memory, so that like a month later, if you come across someone with influenza, your immune system will remember and it will help protect you from getting infected. But it does not give you influenza infection. So the way that vaccines work, they really work by kind of activating your immune system in a specific way, right, to give you protection against. So let's take the pertussis vaccine, for the whooping cough vaccine, for example. So the way that vaccines are made is they either take certain parts of a bacteria, like the whooping cough bacteria or pertussis, and so they may take some parts from that bacteria and put it into the vaccine. And these are parts that our immune system would also recognize if we happen to be infected with that bacteria. And so our immune system says, okay, wait, what are these? There are these proteins here. I don't recognize them. I'm going to activate my immune system because I don't want them there. And whenever that happens, right, you're immune, so you have antibodies that will help give you protection, and you also develop memory right? So just in case you encounter that, that bacteria at another time, your immune system will be ready to be activated and will keep you from getting sick. And so you can either, so some vaccines are made in that way. For some vaccines like flu, you can inactivate a virus, but that's why vaccines work. They work by just priming our immune system against some of these bacteria and viruses that could make us sick. And so this is another thing that a lot of people have questions about, dangerous chemicals in vaccines. So vaccines do have some chemicals in them, right? But I'm not calling them dangerous chemicals. They are chemicals that really help vaccines work better, and they help with vaccine safety, and they help them last so that we can use them. And so, as I said, a vaccine can be made either from a killed virus or maybe some proteins from a bacteria, but you do need to kind of add that to some other things to help keep it stable, right? So that it'll, you can store it in the clinic for a period of time, that you can keep it from being contaminated by other, there are bacteria everywhere, right, in the environment, on our hands, and so you want to make sure that the vaccine won't be contaminated by anything. So some of the things that you add to a vaccine will help with that. So really it helps keep them pure and helps us be able to store them safely, and also can sometimes just help augment or boost the our immune response to the vaccine as well, to help them really work well. So yes, there may be some chemicals, but they're not dangerous. Again, as I said, vaccines are tested. Safety testing is very, very extensive for vaccines, more than even for other medicines. So this is really just because of the way that some vaccines, work. So sometimes your immune system just needs to see these, what you call antigens or proteins, or more than once, to really get a nice durable immune response. And so that's one reason why. So that, so for example, the HPV vaccine, that there's a series. You have to get 2 or 3 doses depending upon when you start, and that's really why. So the first couple of doses will really just prime your immune system. It's just getting it started, so to speak, and then the next or final dose will really be your boost that really helps establish memory. For other vaccines, for some over time, your immunity just starts to decrease a little bit over time. And so you need a booster periodically just to get it picked up again, so to speak. So that's how. And different vaccines, they just work a little bit differently with your immune system. So this is another concern that some, especially parents, have about vaccines. And so, this is something that really has been, especially since, the kind of Wakefield paper that raised this question about autism. Since that time, many scientists have looked into this question of whether vaccines can cause any mental disabilities. And there really is no evidence that vaccines will or can do that. And, if you really think about, well, how would that happen? Like, how would a vaccine cause a mental disability? It's even difficult to think of like a pathway, a way for that to happen. But that is something that's really been investigated. The goal is to make sure that we have safe vaccines, and so people really do take that seriously. And there are many different ways in which safety is monitored for vaccines. They are, yes. So there are lots of, we have a lot of vaccines in our schedule now, but if you look at the list of things, vaccines under development, that list is pretty long as well. So Zika virus, yes, there are efforts to make a Zika virus vaccine, a vaccine against malaria, a vaccine against HIV. Ebola also, if you remember the Ebola outbreak from a couple of years ago. There are quite a few different, a new kind of influenza vaccine that we wouldn't have to get every year. There are lots of vaccines under development. There are even vaccines under development. So vaccines, we take them to prevent infection, so they're preventative or prophylactic, but there's some vaccines being developed as therapeutic or to help treat different conditions as well, like to help things like cancer, for example.